Let me share some data with you that should make you mad. According to the American Thyroid Association, over 60% of Americans that have thyroid issues don't even know they have it. And of those that are being treated because they were diagnosed with a thyroid issue, upwards of 15% can't even feel well because the medication they're on, they cannot activate it. That's millions of Americans that are on meds that are not getting better. And for those of you guys without a thyroid, that's a big deal because you're dependent on having enough T3. And if you can't activate it, you don't have the backup system to make up for that because it got cut out. I am not okay with this. That's millions of Americans that are not getting well. Why? Because doctors are not doing the right tests and are not giving the right guidance. And you shouldn't be okay with this either. That's why I've decided this month I'm going to host the Thyroid's Lab Masterclass. It's going to be on January 21st. It's a Wednesday at 6:30 p.m. Eastern. The purpose of this live masterclass is to give you the information that changed my life. How to finally understand your thyroid labs, what the patterns mean, what to look out for, and what to do about it so that you can walk into any doctor's office and you can talk to them about what's going on with your health. And if you have a thyroid, hopefully you don't even need to go into a doctor's office. So this Thyroid Labs Masterclass is going to be live. I'll be answering your questions at the end, so you can submit it during the talk or you can submit it ahead of time. To sign up, this masterclass is only $37, guys. Go to my website, drrebeccawarren.com, DRREBECCA, warren.com, or go to the show notes, click on the link, and get signed up. You don't want to miss it. It's going to be amazing. I was never told this about thyroid hormones. I am going to start a series on all the things that I was never told about at the beginning of my healing journey, and a lot of the main things that I find a lot of people are not told when it comes to thyroid hormones. Now, the purpose of this is to start getting you to think deeper and understand more the complexity of the thyroid and thyroid hormones and overall healing and the connection with the body. Some of these you guys have heard about already, especially if you've watched my videos, if you listened to my previous podcast, but some of these you may not have. And again, the goal is to just debunk this idea that when it comes to thyroid healing, it can be a quick and easy fix. Because for a lot of us, when we have that thyroid dysfunction and dysregulation, it's been years, if not decades, in the making. And when you go into the medical system, you're essentially given a pill and you think everything's fixed. And then you develop more issues down the road and you don't realize that it's all connected because you never healed the issue that caused the dysfunction and dysregulation. So in my own health journey, I had my thyroid removed, but it wasn't until I really dug deeper post-thyroidectomy that I was like, wow, I had all the signs and symptoms that things were wrong. I mean, heck, having a gallbladder attack at 16 that left me in so much pain. I was in the emergency room on morphine. There's nothing normal about that. Although I was sold as it was normal, like it's okay, we can get the gallbladder cut out. And so as I really dug deeper into my health history, especially when we're looking at things like thyroid cancer and disease, like that's developing in the body for years, if not 9, 10 plus years. And so I had to go back to my childhood of all these irregularities, all these things that were popping up that we just thought were okay because we could manage it. I had to go back and see like, oh, okay, so this wasn't normal. Like constantly having strep as a child wasn't normal. Just being overweight wasn't normal. Like all these little things, having really painful periods, these things were not normal, but they were manageable. So a lot of people didn't give me the guidance I needed. A lot of doctors didn't give me the guidance, the education I needed that, hey, we need to do something about this because it can get worse. So no matter where you're at this journey, whether you have your thyroid, you're healing your thyroid, or you have your thyroid removed, these are some really important things I was never told about thyroid hormones that I think you should know about. All right, so let's go ahead and jump right in. This is a big one. Talk about this a lot, but free T3 is the hormone that actually does the work. And there's a lot there about T3 that I was not told about, and there's a lot that you're not told about. And I mean, I could do a whole episode just on T3, But T3 is the hormone that works on the cell. It's what produces, I did a whole episode on the mitochondria and the T3 relationship with the mitochondria. It's that ATP energy production. But here's some things that I was not told about, that a lot of you guys are not being told about in regards to T3, is that number one, it's really, really important. Okay. The T4 has to be converted and activated into T3, and that your thyroid issue could be a conversion activation issue, whether you have a thyroid or you don't. And this is a really big problem because the main approach to that low thyroid hormones is T4 only therapy. And if you're not activating that or converting that, then you're not going to feel well. You're not going to function well, and you're going to have all the symptoms and issues that you have going on. And the problem with that is that, like, I remember feeling like I was going crazy because my labs looked fine because of the TSH and T4, which is affected by the T4 medication, but I didn't feel fine. And I had all the signs and symptoms when I did my own research that I was hypo, but they kept telling me that my labs were fine. Here's some other things to understand about T3. So, okay, it enters the cell, binds to the receptors within the cell, works in the mitochondria, ATP energy. But there's a lot of fear around T3, especially when it comes to T3 medication. Well, before we get into T3 medication, let's talk about those of you guys that are trying to heal your thyroid. Like, you have to understand complete labs, TSH, free T4, free T3, reverse T3, TPO antibodies, thyroglobulin antibodies. Get my free ebook that explains all the labs you should be getting. But you have to understand where in the process, if you want to heal your thyroid, there's that big disconnect, right? If that T4 is low, then you know there's a thyroid gland. There's something happening at that thyroid gland. But if that T4 is within optimal functional ranges and that T3 is low, then we know there's an activation conversion issue that you need to address. And there's multiple different things that can contribute to that. You got to look at your body as a whole and see, like, where's that roadblock? If your T3 is good within functional range, if your T4 is good within functional range, or let's say your free T3 is trending lower and that reverse T3 is high, then you know, oh, my body's under stress. That reverse T3 is competing with free T3. If you have thyroid antibodies, I want you to understand that, like, going online and watching a video that says take iodine, take selenium, and you should be good to go is not how you're actually going to heal. Your body is uniquely yours, and what caused that dysfunction and dysregulation has to be addressed. So if you have low T3 and you have these stomach issues that you've been kind of managing, like, one thing I hear a lot of is like, oh yeah, I do get some constipation, and yes, sometimes I get some diarrhea. First of all, that's not normal. There shouldn't be any constipation cycles going on there, okay? But if you are looking at that and you have low T3, hey, that gut, or you've had some gallbladder issues, if you've had your gallbladder removed, hey, big red flag that there's a gut component, there's a liver component that's causing low T4 to T3 conversion issues. Let's say you have some anemia. Let's say you have some skin issues. Let's say you have some memory issues, some anxiety or depression. That can be connected with some toxicity issues if you've lived in a moldy home and and you've thought about it, you've been exposed to mold. If your immune system, your white blood cells are low, you've got to look at what is the thyroid panel looking like, those patterns, and what are some other things that are going on? Because those are going to go hand in hand. And the problem is that when you go into the medical system, you get an endocrinologist for your thyroid, you have an OBGYN for your sex hormones. If you have gut issues, you have a GI specialist. So you get into this misconception that all these separate systems are separate and they're not interconnected. And these doctors are not going to look at the interconnectedness. I had a client that keeps struggling with SIBO, that keeps coming back, but she doesn't have a thyroid. Her T3 is low. Guess it's connected. You're going in, you're doing all these crazy antibiotics, steroids, antifungals, but your T3 is what's going to affect the microbiome in the small intestine. Like, that has to be optimal so that SIBO can cause thyroid issues, that thyroid issues can cause SIBO. So I need you to start looking at things differently in that way. But for those of you guys that have to be on thyroid hormones, especially post-thyroidectomy, there's a lot of fear and misunderstanding around T3. Yes, too much T3 is dangerous. You don't go on and take a ton of it, like if you're taking thyroid gland or thyroid meds. But when T3, and let's be real, like thyroid hormones is kind of like it's treated just like this blanket, like everyone get on T4 and you're good. But can we look at the fact that we are just like this very complex, interconnected, intelligently created body, this all these systems, our history, our bioindividuality, and thyroid hormones, should you need it, like I need it, there's an art to it, a science to it that's going to be uniquely you. Like, do you need T4? Do you need T3? Do you need NDT with some T4? Do you need NDT with some T3? Like, there is an art to it. But because thyroid meds is just like, it's essentially like you just, what is it, you throw out the baby with the bathwater, you're just like, boom, they just put you on it and move on your way. We're missing the delicate nature of optimizing and tweaking to our bodies. And that's what I find for most people while they're suffering post-thyroidectomy. When I'm working with post-thyroidectomy clients, the first few months, and especially in my community group, there's people that I've been like, oh my gosh, like months I spend teaching them to not be afraid of T3 and to understand how minor tweaks have a major impact. And those individuals that follow my recommendations go in and talk to the provider, and they have a provider. Listen, I don't need your provider to be the know-all or be-all of all of these things. I just need your provider to listen to you, respect you, make those changes, and retest appropriately. I have another client that did a consult with me for my group, and they have an endocrinologist that's not willing to do anything besides T4, but she has a GP that was like, listen, okay, fine, we can try it. And he got her in this small amount, and oh my gosh, she felt so much better. Like, you need someone that's just going to listen. And I know it can feel overwhelming out there, but I truly believe that we change how doctors, especially the doctors that care, the prescribing medical doctors that care, we change how they practice by speaking up and being empowered and asking for more and not settling. And that is exhausting. I know what that's like. I don't prescribe medication. I have to still work with prescribing doctors. And y'all, I know it's not easy, but it's worth it, especially when you get to a place and you're connected and you meet someone that's just going to listen. Get educated, join my community group, watch my videos, listen to my podcast episodes, be empowered, and then walk in and together work on optimizing that. But I spend months. One of my clients, I have so many stories, guys. One of my clients now, she's just working with me. Like every year, we just work on new goals and new health things. But at the beginning, I remember we had this whole conversation, and she's like, can we start detoxing? Can we start doing this? I'm like, girl, no, because you're still so low with your thyroid hormones. She didn't have her thyroid. And I spent months helping her and making her break the fear mentality, because she had one doctor, and I'm going to talk about why this is happening, right? That was just like, oh my gosh, T3, and oh my gosh. And she was truly so afraid. So between myself and her prescribing doctor, I was able to connect her with an amazing practitioner in Canada. If you're in Canada, you need someone, I do have someone, reach out, email my assistant, we'll send you his information. I love working with him, but it took months for her to break that fear. And she broke that fear, and now it's like, oh my gosh, her health is so much better because she's optimized those thyroid hormones, and we're moving in that right direction. And so let's talk about the fear around T3, what it truly comes down to. And now that I've interviewed doctors, I'm interviewing researchers, these episodes are about to go live, I am realizing it's because the doctors just don't know how to do it. Whether they care and they just don't have the time, or, they're just concerned because they just don't have the education to feel confident in doing it. Or I'm going to be real with you guys. I've interacted with so many of them in my own health and working with my clients. There's a lot of doctors out there with an ego They don't care. They're going to do it their way. And how dare you, what's that saying? Like, confuse my medical degree with your Google search. My Google search got me to some of the greatest researchers, some of the greatest books, some of the greatest studies. My research got me to other post-thyroidectomy patients whose doctors were actually willing to try something new, and it changed my life. Don't ever be discouraged to do your research and to be educated and empowered. And if your doctor's doing that, run out of that office. But going back to what I was saying, what I'm finding is that doctors just don't feel comfortable. And you know what? For those that are just like, I just don't know this, you know what? Thank you. Because if you're not going to do it right, there's two different things that are going to happen. Either they're going to give you to dangerously high levels and they don't know how to maintain you, or they're going to put you, this is another thing I see, they'll put you on really low amounts of T3 and they're like, boom, you're on T3 and send you on your way. And so then you're like, well, doc, I'm on T3 now and it didn't fix everything like you said I did. But I'm like, well, yeah, I saw this in my Facebook community where they're on 5 micrograms and they're like, oh, I feel a little bit better, but and I'm like, well, that doesn't mean that's 5s for you. You could be needing 10, you could be needing 20, you could be needing 20 and 5. I don't know, because your body is yours and not everybody's going to be the same. I do have people ask me like, how much are you on? How much are you taking? What are you doing? And I do share it. I like to share it because I like hearing what other people are doing, but that's what I've needed for my body. And I'll tell you right now, what I'm doing with my thyroid hormones is very different than I've ever done in the last 20 years. And I'm about to start tweaking differently than I've ever done. But the problem is the fear around it. Listen, and now I'm going to have to start getting more bold on this. For those of you post-thyroidectomy, I truly, truly believe a majority of you post-thyroidectomy need T3. Maybe not everyone. Maybe you have some heart issues. Maybe you're more sensitive. Like, not everyone. A majority of you do. But when done correctly, it can change everything. And a lot of you guys are given incomplete information, misinformation, and fear when there's no basis and foundation for it. Like, it's just, when done well, when tweaked appropriately, when retested. Oh, another thing is this. So remember, the two different things I see with people that are not, with doctors that are not well versed with T3, either they could go too high. I don't see that. I will be real with you. That is a possibility, but I don't see that. The majority of the time, I see it too low, and then they send you on your way and they test you every couple months, or it's too low and then they wait too long to up it. And so a lot of you guys will spend like a year trying to get your thyroid hormones optimal. And oh my gosh, you guys, that sucks. And so the idea, I want you to understand, this is information that you've got to get down. And if you have your thyroid, some of you guys have been on thyroid meds 5, 10, 15, 20 years. Some of you guys have had thyroid antibodies that have destroyed your thyroid. Like, if you want to truly understand this more and have the guidance and support monthly, I really, really encourage you guys to check out my Thyroid Inner Circle membership, my community. The doors are about to open. Please check out the link, join the waitlist, join in there, because it is a process of finding the doctor, going in and getting what you need. But man, like, you were never told a lot of this. A lot of you guys have never been told this. You need T3 and it needs to be done the right way. And just being on so little for so long and just struggling, like, listen, when I became a doctor, I became a DC. I'm proud to be a DC. It changed my life. My DC changed my life. I didn't ever want to prescribe medication. I didn't want to get sucked in to insurance and that medical system. I loved being able to help people love their bodies again, trust their body again, and work with their body. And I've 8+ years of schooling here, guys, and I have never wanted to go back except in the last few years. And there's a small inkling, and I'm like, oh my gosh, should I go back just so I can help prescribe meds? Because my gosh, it's so much hard. It is harder. I will be real with you, to help people heal and trust the process and trust their bodies again and undo stinking thinking and get rid of fear. But I'm gonna be real with you guys. There's a lot of prescribers out there like that you guys would love and rave about if they would just try a little more with your thyroid hormones. Like, I think about them like, oh my gosh, you guys I would have people out the door because I would just listen to you guys. I would tweak it, and you guys would think I am the best doctor in the world because I'm just listening and messing with your thyroid hormones. And it just breaks my heart, and it frustrates me, and it makes me mad that there's so many other doctors out there, medical doctors that can prescribe, that could do that for you and just don't. Now, that's not everyone. I've interacted with some great nurse practitioners and DOs that will listen, but man, there's a lot of them out there. So I am not going to go back to school to prescribe, but I will let you guys know this because I've had people say, like, do you know anyone that could prescribe or do this? The goal of me working within my community, like being a part of my Thyroid Inner Circle community, my goal is this. I need you to understand, this isn't just for thyroid hormones. You need to be able to walk into any doctor's office. You need to be able to walk into the hospital. You need to be able to go in there and find your voice and be an active participant in your health care and an active, informed patient so that you can do true informed consent, which is shared decision making, okay? I teach you guys this when it comes to your thyroid hormones, but you need it for everything. I've shared this story before, but my father years and years ago suffered a brain aneurysm, a brain bleed. My sister and I, my family, my siblings, we went down there when it happened, and he was in the ICU. And let me tell you this, the doctors, the nurses, minus one, who, just so you guys know, there was one nurse in there that just was rough with my dad, was not compassionate, and we spoke up. We got her out. We make sure everyone knew. They apologized, got a new one in. Listen, I'm going to speak up. If I'm not getting respectful care, I'm speaking up. If my father's not getting respectful care, I'm going to speak up. But besides that one, everyone was amazing. Oh, his doctors, his PTs, everyone there in that ICU, neuro ICU, was amazing. And I did not go in there, my sister and I did not go in there saying, what are you guys doing? No, I mean, the fact that they could go through his femoral artery to his brain, stop that bleeding, incredible. I have so much respect for what they did and how they treated and supported my dad. And this is just a tangent. My dad's insurance, you want to talk about insurance? You want to talk about, guys, it's a company. They want to save money. I remember reading stats years ago, and I got to look up the new information, but a majority of bankruptcy cases were medical related, and within those, a majority, I think it was over like 60%, had health insurance. And when my dad was in the ICU, he could barely write, couldn't really do stuff himself, and his insurance company wanted him out of the ICU, and instead of getting occupational therapy, physical therapy every day, they wanted a few times a week. His doctor, I think it was the head physical therapist, and someone else had to go and fight his insurance company and say, no, he needs to be here. And that made me sick because I'm like, oh yeah, yes. As a reminder, you can pay your insurance. You can think they're going to cover everything. And in the end, they're a company that wants to save money. But going back, that was just a side note. I remember when we got there, we just asked questions, and it wasn't in a we were just, every day they would give us a sheet. And when we arrived, there was all these meds, and we just wanted to understand how we could support my dad. And we started asking questions about the meds he was on and what they were giving him. And by the end of the week, they were so great. Like, they would let us know, oh yeah, we put him on this originally, but you know what, actually we don't need that. Let me check with the doctor, and actually I think we could stop this. And by the end of the week, his meds were cut in half because they were just, there's a lot going on in the ICU, right? But just having that conversation and having that awareness, being involved, helped my dad get on less meds than what he needed. He didn't need all of that. And it was just so eye-opening. It's always a good reminder, when I go into a hospital setting, I've advocated for so many family members in the hospital and doctor's offices, just asking those questions. With the right team, they're going to be like, oh, you know what, actually, let's do this. Or, and that was just so eye-opening that because we asked questions, it held them accountable. It gave my father better care, and it was shared decision-making, which was so fantastic. And I think that's really important for you guys to understand. But you're never going to feel better if your T3 is low. You're never going to feel better if you don't have complete labs. You're never going to heal your thyroid if you don't understand in what step of the process things are falling apart or being disconnected. And that's really important. Really, really important. Again, guys, if you'd like more guidance, more support, please check out my Thyroid Inner Circle. Those doors will be opening here in the next few weeks. Another thing, okay, let's talk about the second thing I want to touch on today. And I'm going to go ahead and put a link to in the notes section. If there's things you want me to touch on in this series, let me know, submit it at the link, and I'll make sure to touch on that. But the second thing is the reverse T3, okay? This is one I was never told about this when it came to my thyroid hormones and really understanding the reverse T3 and what it means when the body pulls that emergency brake. Now, a lot of what you're not being told about reverse T3, again, I remember when I first started looking at studies about reverse T3, I agree, like there wasn't, and it might be different now, there wasn't a lot then really looking at reverse T3 as a marker for like, how do you use this in this setting? Most of what I found was in emergency situations where reverse T3 went up when people were in a coma or really chronically sick. But reverse T3, I think, is such an important marker to be used the right way. Like, and a lot of doctors don't do reverse T3 for two different reasons. It's not going to diagnose anything. It's not going to change what they do. And number two, they're not going to look at reverse T3 because insurance is not going to cover it. That's what I hear a lot of. Those are the two biggest reasons for why, doctors are not looking at reverse T3. But under stress, reverse T3 is a good marker. Let me tell you the two things that I see with reverse T3 when we're looking at reverse T3 at your labs is, what does it mean when it's too high? What does it mean when it's too low? I'm going to start off with too low because I tell people, I'm like, ooh, you are not feeling great right now. A lot of you guys don't even realize you're not feeling great. I always give the example, it's like a fart in the room. Someone passes gas, you smell it, you're like, oh, this isn't great. But then you get used to it. A lot of you guys don't even realize how not normal your normal is. But when I see reverse T3 on the low end of that range, we're looking at 9, 10, like if that range is out of 8 to 25, what I'm looking at is like, oh, your T3, the only reason your T3 is where it's at is because you're pulling out of your reservoir. So your T3 is maintaining for now, but you got to pull out a reverse T3. Reverse T3 is this backup reservoir for you. And that's a problem because once you use up your backup, that free T3 is going to start come crashing down. And I had someone recently post-thyroidectomy that I was looking at their labs, and I'm like, ooh, I get your doctor. You need to go talk to your doctor right now, your prescriber. You talk to your doctor right now. These thyroid hormones need to be optimized. These thyroid hormones need to be optimized because that T3, I said, so just so you guys know, reverse T3 usually takes like 2 weeks to 10, 14 days to get the results. You'll get your thyroid labs. That one usually takes longer. And I told her, I said, listen, I bet you when you get your reverse T3 is going to be low. She got a reverse T3, it was a 9. And I'm like, yeah, the only reason you're maintaining any kind of T3 levels is because you're pulling up your reservoir. Like, this is a big red flag. You don't have enough. So low reverse T3, like, is telling you that. High reverse T3 is telling you, oh man, your body's like, hey, there's a problem. I don't know if it's an infection. I don't know if it's mold. I don't know if it's Epstein-Barr. I don't know if you have a gut infection. I don't know if you have parasites. I don't know if you're sex hormones. I don't know if it's because you're anemic. But your body is saying, we need to start saving up. So what you're doing is when T4 goes into the liver, that free T3 comes out, you're doing some reverse T3. Instead of making free T3, your body's like, I'm going to make more reverse T3 because we're about to crash and burn, and I want to make sure I have a lot saved up. But the problem with that is, so instead of activating into free T3, you're pulling up reverse T3. That reverse T3 now is going to compete with free T3. Reverse T3 is a good marker. Now, I'll tell you this. Do I order it every single time? No. I ordered it at the beginning, like, save some money. Like, if I see a trend and I understand what's going on, I don't do it every single time. But at the beginning, yeah, you need to know, like, what's going on? Like, what's the signaling with my body? Reverse T3 it looks like almost identical to T3. It will compete with it. And it's really important for you to understand if you're using it up or if it's competing with your free T3. Inflammation. A lot of you guys, this is another thing I've found, is that some people don't even know they have like a blood sugar issue brewing. Listen, we have so many different types of diabetes and blood sugar issues now. It's not just a genetic thing. It's not just a family thing. Anyone can develop these blood sugar issues. And if you have inflammation, like there's so many things that can go in and make how you feel on thyroid hormones, like it can affect how you feel on thyroid hormones, optimizing your thyroid hormone meds, or how to heal your thyroid hormones. Because if there's another issue, it might not be related. Some of you guys have thyroid issues, but it's really not the thyroid gland. It's because you have all this other stressors going on inside of your body. So it's really important to understand is that what I never understood is like not only why I should test reverse T3, but how to utilize reverse T3. And again, if your doctor is not looking into that, maybe they're not interested, you're missing a marker that can tell you some really great information. Now, I could go on and on. I have more I want to talk to you guys about. So I hope you subscribe, follow along. Let me know if there's topics that you want me to kind of what you never understood or really understood in regards to thyroid hormones or thyroid healing. But I have episodes coming out about anxiety. Like I never knew about anxiety and my thyroid hormones or my sex hormones and menopause with my thyroid hormones. I want to give you guys the understanding or the education to understand your body better and to know, okay, I want to know, like, listen, even if I never work with you guys in a one-on-one setting, I want you to take this information and be like, okay, I understand my body better. I understand. That's one thing. That's how I know, like, when I work with my coaching clients, especially those without a thyroid, because those of you guys with a thyroid, my goal is that you never need to be in your doctor's office. Like, you just use it for emergency, 911, like if you need it. That's always been my goal for you guys. For those of us without a thyroid, I mean, we don't have a choice. We need thyroid meds. And my goal is to always get to a point where people can say, like, I teach women about their sex hormones, cycling, those of us without a thyroid, to be like, oh, you know what? This is what I'm feeling. This is what I'm experiencing. Let me go get some labs done. Oh, okay, this is what my labs show. This is what it means. This is what I need to do, whether that means go to talk to your doctor or change some things up or get into fasted state or get into a refeeding state. My goal is that you come to trust your body again. You come to understand and reconnect with your body and understand that it was fearfully and wonderfully made and how to work with it, not against it.